in this world is all you know. Hands up, you're working it, and then get yourself together. When you call the dominoes fall, it's time to go. Now I feel it so far away. I see the colors and all the kids going home. Night is crawling up to the day. I hear the birds ringing, the sirens all singing. Just wanna stay up all night with you. Just wanna stay up all night with you. There's nothing that I wouldn't rather do. Just wanna stay up all night with you. Don't wait for nothing now. 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 Nothing now. One, two, what you doing? I've been jumping through some hoops. Wanna get my body loose. Wanna tell you what to do. I've been running out of bounds like an animal struggling. Looking for a diamond. I'm trying, I'm fighting, riding in the rhythm now. I just wanna stay out all night. Wanna stay out all night. Just wanna stay up all night with you. Just wanna stay up all night with you. There's nothing that I wouldn't rather do. Just wanna stay up all night with you. Turn up Premier. If you don't really care, never know that you're there. If you got time, take it up there. Turn up Premier. Living out on a prayer. Never know that you're there. If you got time, take it up there. Up all night with you. If you don't really care, never know that you're there. If you take it up there. Up all night with you.
She's a miracle. She's a miracle. Diamonds. She turns thieves to diamonds. Whoa. Trying to find that silver lining. Whoa. And once in a while, I'll go walking in the twilight, counting down to midnight. Close my eyes and wait for her to shine. I'm hiding in the shadows, praying that she'll break free. In the dark of the night, she got danger on her mind. She's a $1 million baby, nobody can explain.
Hi, everyone. Thank you for joining. In just a moment, we're going to get started. We're going to let a few more people trickle in here before we get kicked off. All right. Good afternoon, or if it's still morning, good morning to everybody that has joined us today. So thank you so much for taking some time to join our Cardinal Health sourcing team and talk a little bit about our national brand scorecard today. Quick introduction, my name is Chris Theodo. I'm one of the directors on our national brand sourcing team, part of Emily Barnhart's national brand sourcing organization within Cardinal Health. I'm going to be providing a quick introduction and run through the agenda and just cover some of the high-level bullets we're gonna talk through today as we introduce you to our new national brand supplier scorecard. So again, thank you for joining. We're really excited for the conversation and a little bit about what we're going to cover today. So we're going to talk through some of our KPIs, where we've been and how we got here today with our existing national brand scorecard and rolling out this new version of our updated national brand scorecard for 2024. Talk a little bit about that transition and the timeline and when you can expect to see our updated scorecard. We're going to walk through the metrics that are contained in the new scorecard, a little bit about the design, get everyone familiar with the layout and where certain data points and metrics are located within the scorecard and in the backup details that are provided along with it. Talk a little bit about the communication cadences and some of the improvements we've made there for our new version of the supplier scorecard. And then we'll talk about kind of next steps, what you can expect. And then if you can hang on for just a couple of seconds once we wrap up at the end, we will have a short survey that'll pop up in the Zoom window just for us to get a little bit of feedback about the training today and your understanding about where we are and where we're headed with our national brand scorecard and KPI management for Cardinal Health's medical distribution channel. So without further ado, we'll go ahead and jump in. Just a quick high-level comments. And Christian, if you want to go ahead and go to the next slide. Talk a little bit about why Cardinal Health manages performance, why it's so important for us, why it is an important component to our distribution services agreements with our national brand suppliers, and what we're doing to improve KPIs. So with this effort, we hope that you see that Cardinal Health is very focused on improving communication and transparency for our suppliers and upstream business partners with you all. Our customers, since the height of the COVID pandemic, have really focused in on supply chain transparency and resiliency. We see more customer inquiries around service level, including upstream and inbound, to where customers are no longer just looking to Cardinal Health or looking to their distributor. They want to know what is the upstream performance into Cardinal Health. How are our suppliers performing? What are we doing to make sure that we're providing that value of distribution to them and improving their inbound performance so that our end customers have the product that they want when they need it, and it is on the floor so that they can use that to take care of their patients. We realized that this was super important, and while we did launch a scorecard about 5 or 6 years ago, we saw an opportunity for us to revamp that scorecard based on feedback from our supplier partners. And we've invested into new technology and resources, established a compliance management and supplier performance management team within our national brand sourcing organization that is really charged with providing you a dynamic, concise scorecard and some dashboard tools to leverage so that there's more transparency, so that as a supplier shipping into Cardinal Health, when the product leaves your facility and it's en route to Cardinal Health, you still have some visibility and understanding. Did the product arrive? When did it arrive? Does Cardinal have enough product to meet that end customer demand? So we have embarked on this journey over the last year to improve that communication and transparency for you all. So we're really excited to get to this point where we can launch the scorecard to you because we think it will be a very valuable tool and really provide some of those actionable insights. I think with our existing scorecard, we realized there were some opportunities. While it has a robust set of data that accompanies it, we really wanted to take a step back and look at what are the high-level action items that a user of our scorecard and a supplier partner can take to improve those supply chain KPIs and performance into our channel. So that's a little bit about how we got here. So we'll go ahead and jump into kind of a discussion on our timeline to get here and a little bit about the process of launching our new supplier scorecard. If you want to go to the next slide, Christian. All right, talk a little bit through this transition and the timeline to the new scorecard. I'll actually bring on Alex Shogolev, who is our manager on my team, managing our supplier performance management organization. So Alex, I'll kind of toss it to you to talk a little bit about our new scorecard and how we got here.
Thanks, Chris. And I appreciate the time. We really value the opportunity to speak directly with our supplier community. So thank you so much for carving out part of your day for us. Christian, you can actually go to the next slide. We are very excited. We're not going to bury the lead anymore. This is the transition of old to new that you'll see on your screen. You're familiar, hopefully, with the scorecard on the left that Chris mentioned that we've had for about 6 years. And we felt that after a lot of scorecard conversations with folks, I think it was heightened during the pandemic. We saw just a lack of engagement with our current state, largely due to the fact that it was not very digestible. If you look at that, there's about 300 numbers on the page that get that on an email, and you don't really know how to interpret it. You don't know exactly what, as a supplier, what you should do to have an influence of your supply chain and our mutual end customers. We really aren't satisfied with where that has been for the last 6 years or so. And so we're transitioning to what you'll see on the right. We're partnering with data solutions experts on our team in a new platform with our Celonis tool, which you can kind of view as, from your perspective, will be a data visualization tool, but it's also a data mining tool that we can directly connect to our business in every way and automate our scorecarding and improve the offering to a supplier. So we're going from what we would call an antiquated, just numerical top sheet to what you'll see on the right, which is 3-tiered for what you'll see. And just to highlight, we're going to go into each of these in way more detail, but we have our executive summary, which is the one you'll see on the top. That's intended to be a top sheet that we can pass to supplier leadership so that they have a firm understanding of their performance in the previous month with Cardinal Health across a variety of categories that interact between our two companies. The next would be our tactical summary, and that's where we're really trying to improve upon the actionable and prescriptive insights that we are providing to our supplier partners. In the past, with the scorecard on the left, it requires a bit of interpretation. It also requires multiple people digging into raw data files to find drivers, to find the high impact materials or high impact occurrences that drove service level or drove lead time performance. We want to bring that to the front end, that when you receive that scorecard email, you have it right away. We have that base analysis done from the beginning to where you can take actions right away, and then we can benefit our mutual customers as soon as possible. And then we are continuing to provide the backup detail, and that's what you'll see with the Excel spreadsheet. We are adding to that and improving upon that, but we will still have the raw data file that you're used to. And Christian, you can go to the next. And I just want to walk through a little bit of how we got here. We are very excited to be here today. I think we did not anticipate it taking a full year from when this project started, which a little bit more now in March of 2023, but it has. And just to give you an idea of what that process looked like, we spent the first 2 to 3 months researching, conducting a significant amount of both internal and external interviews to understand what suppliers wanted, what was best practice. We have also Cardinal Health received scorecards from distributors from as a manufacturer themselves. So basically just as much intake as we possibly could to understand what makes a great scorecard and what people actually want in a scorecard. And because of our new utilization of our Celonis tool, it was net new to put a lot of this data into that platform. There was a significant undertaking in building the infrastructure to be able to deliver an automated scorecard. So that took a few months. And from then we tabbed some of our supplier partners, and we did a pilot for about 3 to 4 months into consistently improving the offering, consistently taking in feedback, which got us to March, where we trained internally across our buying and sourcing teams, along with the other teams that will be represented that you'll see in a second on the scorecard, to make sure everyone felt comfortable with where we were and where we were going, which then brought us to April. We are going to go live with the scorecard next week. We also have 2 trainings. The first is today. The second will be on the 16th. Both of them will be recorded and distributed. If folks on your team cannot make it, or if there are suppliers that can't make it, we'll obviously communicate that. And then I think a key point of this scorecard initiative is what happens after the go live. Previously, the scorecard that we had 6 years ago We created it. It took an undertaking to create it, and then it kind of sat and it left. Small tweaks over time, small changes over time, but really nothing significant. That's not something we want to replicate. We want to consistently improve this product so that we don't have as large of an undertaking to create a new scorecard. We've called this MBS 2.0, National Brand Scorecard 2.0. We're not very good at naming things on our team. That's been identified, but we don't want to get to a 3.0 standpoint that would take another year. We want to consistently improve it. And so part of that is taking in feedback from you all. We want that to be regular, and we want to incorporate as much feedback as we possibly can, as often as we can. So we're excited for this first opportunity to broadly share with you. And so the next part, we want to get right into it. We want to go over the design of what you're going to see on a monthly breakdown. So Christian, if you want to jump ahead a couple. We're going to dive into each metric individually, but want to first just feel comfortable with the layout of what we have. So this is what we're calling our executive summary. And if you'll just follow me along with the number path here. If you go to number 1, this scorecard is limited by CRED or vendor ID. And so that's unfortunately a limitation with our ERP software to be able to get a business unit and all of its data in one place. It aggregates up to that vendor ID. So if you are a supplier that has multiple vendor IDs, unfortunately, they will be split. There will be multiple scorecards that you would receive on a given month. That's something that we are actively still trying to solve for, to be able to present a parent-child kind of CRED, vendor ID understanding, to be able to give a holistic view. But that's also a plug. If it's possible, we would love to consolidate, to have one business under one ID that we can present a full picture really seamlessly. But you will see multiple scorecards if you have multiple vendor IDs. If you drop down to number 2, it is the overall score. So this is an aggregation of individual metrics and the performance on each that you'll see in section 3. So we are rolling this out with 10 metrics, one of which is coming soon, which we'll talk about in a second. But on each of these metrics, you'll see within the circle, like the service level number is 17 out of 20. The other metrics are out of 10. If you add up all of those scores, you'll get the 79 out of 100 from just a scorecard score. Beneath each circle under the metric is the actual performance of that metric. So the actual service level was 94.94%, which equated to a 17 out of 20 score. So all of those scores added up will go into the 100 out of 100 possible in section 2 there. And I will touch on the chargebacks metric is something that will be net new to Cardinal, is a new metric for us internally as well, of connecting to that data. That is something that we will be adding soon. We didn't want to hold off the scorecard for that specific metric, but once that metric is added in, there will be a slight tweak of just the overall breakout of scores. Service level might drop to out of 15. Some may go from 10 to 5, so on and so forth, to get out of that 100 total. But chargebacks rejection rate is a metric that will be coming soon that measures the total number of discrepancies or rejections out of a total chargeback quantity. If we hop up to section 4, this is something that we really feel like it is important and was heightened again during the pandemic. You can see in this scenario, maybe a service level 99 or 94% is very good, but it's helpful to know how other folks are performing, to be able to measure yourself against like-sized or like suppliers in general. So what we've done is we have grouped each of our suppliers into one of 5 tiers. So I'll specifically call out, and this is something we might adjust if it is confusing. We've had mismatching on both sides, but that supplier tier, D is not a letter grade of how you're performing. D is a tier. We have A through E, 5 different tiers broken out by total spend within a 12-month period. And the goal here is to measure suppliers and compare against like-sized, in our channel, supplier spend. And so to the right of the tier, you'll see how many suppliers are in your tier. And then below that, the overall rank is comparing that 79 out of 100 to the other 141 suppliers in this tier. And so that 79 out of 100 is 81st best out of the total 141. We did the same thing with service level specifically. So 94.94% is the 42nd best service level within the tier of 141 suppliers. Just an added level of context so that when you receive your scorecard, you can contextualize how you're performing compared to other suppliers like you. If we hop over to section 5, that is simply a visual trend. One thing that we felt like we were missing from simply an aesthetic standpoint and a digestibility standpoint was a visual trend. Throwing the 300 numbers on a slide or on a page is not very digestible and not very clear. And so right now we have a 6-month trend on 4 key categories, 2 EDI categories, service level, and your overall score. We will look to improve upon that. Obviously, it's not the most real estate possible, so there's hesitant to go 12 months with a bunch of different metrics in there where it would bunch up pretty quickly. But right now, that's where you have a visual trend on important categories, specifically EDI and service level, and your overall score over a 6-month period. I'll drop down to order statistics, and this is one that I'm excited to partner with suppliers on, because we essentially, to be totally candid, have some real estate on the scorecard to be able to provide some anecdotal or just ad hoc figures that help you contextualize maybe some of the figures, the metrics in section 3. And so average lead time is one that we've traditionally had. We wanted to make sure that that was brought over. And then we have open dollars and back order dollars or late dollars. Those are things that we talk about within our inventory teams quite often. Wanted to put that in front of our supplier community as well. So we were talking a little bit more apples to apples when we hop on inventory or calls, cadence calls with one another. But we want to know from suppliers what you would like to see in that space. If there are specific figures that you would like to be referenced or measured, we would love to see if we can connect those and bring them into Celonis and communicate them within this format. The last section, section 7, is our summary of fees. And so right now, current state, we have 2 parallel but separate processes. We have our scorecard process and we have our compliance process, which holds suppliers accountable for performance specifically on service level and 4 different EDI categories that are represented on the screen: 810, 845, 855, and 856. We felt it was important to marry those things together so that you weren't looking at trying to gather multiple emails to get a full understanding of performance from a metric standpoint and a fee standpoint. So we're simply bringing those in together. That will also still remain in the body of the email as it does now. But if you're familiar now, we have service level compliance going out in one email, EDI compliance going out in another. We want to group everything together so you have one trustworthy spot where you can get all the information that you need for your company. And Christian, we can go to the next slide. We'll move into the tactical summary, and we're going to get into this a little bit more granularly. But the idea here is what I mentioned previously as well, that we want to provide actionable insights. We want to provide the highest opportunity drivers for us to impact as partners. This is not something that we are intended to send to suppliers and say, go fix this and talk to us later. We want to work with you to resolve these issues. And of course, some of these you may be aware of, but there are some that probably won't be, that we want to solve together. And we'll just do a quick high level. We have 2 service level scores or 2 service level views. The largest service level misses by material, so that would be the lowest performing service level codes within our channel. That will have the Cardinal code. I know right now this is a dummy scorecard, so it doesn't have any actual data, but we will have the Cardinal code as well as the supplier code on there. Then we have the largest service level misses by DC. So the DCs that are experiencing the most pain when they go to order and their product not being available to them, that typically directly aligns with a certain customer set that we want to be aware of. We also have 2 ASN or EDI 856 metrics represented here. That has become a very large effort within Cardinal and from our supplier community, or excuse me, our customer community, to get better, cleaner, more accurate ASN data. And so we want to work with our suppliers to make sure the delivery dates on the ASN are accurate to what we actually receive or get as best as we possibly can, and to measure the ASN failure reasons, why we're not receiving ASNs, which is, again, is also represented on the 856 compliance, but we want to draw as much attention to that as possible because it has our customers' attention. The other two that are on here, the bottom left, we have lead time quality by DC. Lead time quality is a metric we're going to get into. It is a new metric replacing the lead time coefficient of variance that was on our existing current state scorecard. We have that broken out by DC. Then we also are focusing on the late open orders and order dollars for specific materials, essentially the highest back ordered codes. And again, we'll get into all of this in a little bit more granularity in a second. So the next one is the last thing that you'll receive within the PDF on the scorecard. Christian, if you want to move to the next slide, is our definitions page. And so this will accompany every scorecard every time. It has a detailed layout of the definition of each metric that you'll see on page 1 on the executive summary, as well as how many points make up that metric and the breakdown of points as the score or performance changes. The second page is our tactical summary, which explains each of those 6 views individually, as well as just another explanation of how you compare how we've grouped suppliers by tier. And again, we'll hit on those here in a moment. And the last thing that you'll receive is the backup detail. This will come alongside your PDF. If we want to go to the next slide, that would be our backup detail, which will have 6 different areas. It will have service level, lead time, which is new, and the 4 different EDI metrics. This is obviously Excel-based, matched as much as we could to the previous iteration. When I say previous iteration, I mean current state. A lot of these are going to look exactly the same, but there might be slight tweaks. That is driven because we have a new data platform in Celonis. If there are things, this is another thing, if there are things that you absolutely need, please do not hesitate to reach out to your GSM, to our team, to see how we can immediately work to add these in. We want to add as much helpful detail to these backup files as possible so that suppliers can feel comfortable working through the data to find additional insights if warranted. And again, we also have the lead time one is new. We've historically done that. It's been away for about 2 years. We want to bring it back to the forefront because lead time performance directly influences our ability to plan and forecast our orders. And so we want to drive as much attention to that as possible. And just as a final caveat or final note in number 4 there, if you do have questions or disputes, because some of these are tied directly to fees, obviously, we want you to reach out to your global sourcing manager, and they will connect you directly to your EDI, inventory, or KPI management team. You can also email me. You can email our team as well. Once we connect, we're happy to be supplier facing as well. So now we're going to hop into each of the specific metrics from the executive summary and the tactical summary. If we want to go to the next slide. Service level is the biggest one. It's the one that we focus on the most. And because of that, this metric is not changing from current state. There's been some slight refinement to the metric, really just improving its accuracy as much as we can tell within Celonis, just that change and crossover. So this metric, if you're unfamiliar, measures at a high level, the simple definition is quantity on time. How much of the quantity on a PO line was received in our DC when we thought it would be there. So every PO line from Cardinal Health has an expected delivery date. This date is based on the last 6 weeks of your performance at a SKU level, so DC material combination. We average your performance, and then on every single PO line, we have an expected delivery date that we expect that quantity to be received by. So this metric looks at the quantity, say it's 100 cases. It looks at the date, let's say it's a week from now. And we actually add 2 days as a buffer to account for weekends and other potential issues that could arise. And we add 2 days. So if it's a week from now, it wouldn't be the 11th, it would be the 13th. It would be how much of those 100 units are here by the 13th. And that's just a simple percentage, and that's how we measure service level. Now, we do know that there are other factors that influence service level performance that are outside of your control, outside of Cardinal's control, even at times. So we added in, and this happened about a year ago, we've added in if a supplier sends us an ASN or an invoice 4 days or more ahead of the expected delivery date, and you end up being non-compliant, so the line ends up being late, we take it out of the calculation altogether because of the fact that we can't quantify if it's a supplier issue a Cardinal issue or a carrier issue or some sort of technology issue, we don't want to hold anyone accountable to the metric at that point. So we bake those out and go with the lines that we are confident of compliance versus non-compliance. So this metric, again, is not changing from current state. It is exactly the same. The only thing that you'll see different is a different scoring structure and a different weight. It is out of 20 points. We stop awarding points when inbound service level gets below 65%. But again, this one is exactly the same as current state. We'll move to the next one, which is unfilled lines or open PO rate. So whereas service level is a quantity-based metric, unfilled lines or open PO rate is a line-based metric. So quantity versus this one moves into a line-based, and it's essentially looking at the expected PO lines to be received within that month. At the end of the month, how many of them are still open? It's just measuring it from a back order perspective is what we're trying to tie into. This again is also the same metric that is represented on the current scorecard. It's one that we find to be very important. We're trying to simply add context to it with back order and late dollars and focusing on late materials. We want to add more context to this metric, but the metric in and of itself is one that we feel is important for us to continue and bring over onto the new scorecard. And so the scoring may be inverted from current state, whereas we are not celebrating a 99%, we want to inverse it. So 1 minus that. Well, 0 to 1 is a 10%. It's a 10-point metric. We stop awarding points when it gets 10% or more of your lines remained unfilled that were expected within the month. Go to the next metric here, which is our EDI. And the reason these are next is because these are also maintained from the existing scorecard. We found it important, especially ones that are tied to our contractual DSA or distribution agreement language, we did not want to change. We've aligned on that with our suppliers over a number of years across these 4 EDI categories and service level. Those are, again, not going to be changed with the new scorecard, just presented differently. And just as a reminder, 810 is referencing our electronic invoicing. 845 is our end user pricing and measuring how many of those come across via EDI as opposed to email. 855 is our PO acknowledgement, so measuring how many times we got the acknowledgement from a PO sent to a supplier. And then the ASN, which we've already talked about, the advanced ship notice, is our 856. These are all weight of 10 points and have similar scoring to current state as well. We can go to the next one. This is a new metric, starting a run here of some newer scores. The reason that we are changing this metric is because the lead time coefficient of variance was not adopted very well either by Cardinal or by our supplier partners. I joke around that there were five folks at Cardinal that maybe could explain lead time coefficient of variance well. It was something that we had to re-explain constantly. And if we have to spend that much time explaining what we're trying to hit at, it's not a good metric. So we've moved to a lead time consistency score, which is measuring how often the first goods receipt of a PO line is delivered plus or minus 2 days from the expected delivery date. So we give a 5-day window for every PO line. How often did it hit that 5-day window? Our planning manager would probably not like it to be a 5-day. He'd probably prefer it to be a 3-day. But the reason we measure lead time consistency is because it has a direct tie-in to how we plan and forecast. I know some distributors measure lead time purely if you get it to us in less than 10 days, we check the box and we like it. We know that we're a little more granular. The reason we are more granular is because we value consistency over speed. If our planning manager coined, he does not care if it's a 5-day lead time or a 30-day lead time. He just wants it to be the same every time because we'll order to account for a 30-day lead time. We just expect it in 30 days. Obviously, we still would rather have product sooner rather than later, but the consistency allows for us to plan appropriately for our customers, for end users, and have product on hand at all times. So lead time consistency is a new metric. Again, this is also out of 10 points. We stop awarding points when it gets below 55%. We can go on to the next. Shortages and damages. We are very excited to add this one. We've been able to work with our ops teams and our regional partners to be able to tie into within our ERP and AIM software or warehouse systems to be able to tie into how often shortages and damages occur on a specific PO line within a month. So this is similar to the inverted score of unfilled lines, where we're measuring it from 0 to 1 instead of 100 to 95% for a full score. But this is obviously to tie into our quality at the DCs. So far, we've been looking at this detail, and the performance has been great, knock on wood. But we are excited to add this and improve upon this as we go, and really just want to highlight specific issues so that we're making sure that we account for them when we get on scorecard calls with our supplier. If this spikes, we need to understand how that influences manufacturer back orders and ripple effects into our supply chain. We are not, because of an SAP limitation, able to add in overages. Typically, you'll see OS&D, overages, shortages, damages. We are just going to be focusing on shortages, damages, because obviously those create more supply chain, more customer service level impacts than an overage would. So we'll get into another one here. We can go to the next one. Automation. This is another new metric that we are excited about and that we are actually consistently improving. Some folks may have heard this as touchless order. This is essentially measuring how often an order PO line, flows from order to receipt and payment without any manual touch points, without any stops. It's essentially measuring our ease of doing business with one another. A lot of us are very large companies. We know that there can be some difficulty in doing business. We want to start to measure how easy it is for us to buy and exchange and distribute product from one another. And this is our first step to doing that. So admittedly, we're going to be adding more components to this metric over time, but we are intending to highlight how easy it is for us to buy product, receive it, pay for it without any issues. Eventually, we want to raise the stakes and get into receiving it in full, receiving it on time in full, so on and so forth, to where we can really celebrate when things are running as efficiently, as smoothly as we expect of one another. So this is one that we, again, will continue to improve upon, but are excited to have this ease of doing business or automation score added. And again, it is out of 10 points like the others as well. You can go to the next slide. Now we're moving into the tactical summary, and we'll go to each of those 6 different windows individually, and we'll just go from left, center, and right. So the first 2 are largest service level misses by material. This is essentially looking purely at inbound, what we ordered and what we received on time, and looking at that as a percentage. So obviously the ones with the largest amount of misses are the ones with the lowest service level performance, and are typically, if not always, tied directly to customers asking us regularly, where is this product? What's going on with this product? And a lot of this is supported by our buying teams as well. They'll be reaching out, and we have customer experience teams that are reaching out. A lot of folks that want to know where product is, and we want to aggregate those and communicate those within this space as well. And so that's the largest service level gaps, the ones that if we fixed these specific up to 10 issues, your service level would jump dramatically. Want to highlight those here. The other is our lead time quality by DC. And this is, again, that plus or minus 2-day window, and then going into just aggregating that by the distribution center. And it's essentially which DCs we have the most issue from a planning and forecasting perspective. We order by DC, and so we anticipate that the lead time quality issues will directly lead to inconsistent ordering patterns at these DCs if the lead time remains inconsistent. Obviously, the goal here is the more consistency we have from a lead time perspective, the more consistent our orders will be to our suppliers, and the easier it is for you all to plan for our orders. That's the goal that we're driving to. And just as a note, we do not have the Hawaii or Alaska DCs baked into any of our lead time quality DC metrics, because we know that those are going to have the most issues when we talk about ocean freight and other more difficult modes of transportation. Those are the first 2. We can move to the second 2. The next one is largest service level misses by DC. So similar to material, we're just aggregating that at the DC level and looking at all the quantity that we expected to receive at the DC in a month, and how much of it came in on time. Almost always, this is going to tie into a specific group of customers, and we want to be mindful of that. We want to be mindful of when some of our, especially our largest accounts, are asking for volume, or just any specific customer that has a need that we can pinpoint here, and we can triangulate what may be driving certain issues in certain parts of the country. If we need to adjust carriers, if we need to adjust buy nights when we buy something for a specific DC, this is pinpointing essentially just supply chain pain points that if we can focus on, perhaps we can curb some of the issue and alleviate some of the burden that our customers are feeling. The next one is late open orders. This one we'll give our 5 largest backorder dollared materials to our mutual end customers. We won't have the zeros on here, so it might be less than 5 at times. Hopefully it's less than 5, but essentially just pinpointing the materials that our inventory team, our customer teams are regularly escalating and asking about within our supply chain. Mostly, where is this material? Some of those will be similar to the service level graph in the top left of the tactical summary, but want to highlight the dollar impact that we're seeing in terms of backward dollars, because that is a metric that we track very closely within our inventory and planning organizations at Cardinal. We can move on to the last section, which includes both of our ASN metrics. So have our delivery date accuracy. Again, this ties into the planning piece, but we have significant projects that are underway with teams at Cardinal focusing on delivery date accuracy and improving the consistency and use and quality of ASN information, whether or not that would be the date provided or the tracking information, the carrier information. We're essentially just trying to drive as much attention to the ASN as possible, and the delivery date accuracy is a great place for us to start. And again, low performance here will also indicate some issues from a service level standpoint, as well as issues with a planning and forecasting standpoint for future orders. And then the bottom right is something that you will see also on your EDI 856 compliance backup data. It is the top ASN failure reasons, the top reasons why a line was viewed as non-compliant when it entered our system. That can be a few different reasons that can occur, but we want to highlight those here to drive that conversation, both for the supplier internally amongst themselves and for when we come together on supplier scorecard calls, that we can talk specifically about why these issues are happening. And what happens from there is our GSM team will go and submit a ticket to our EDI 856 team, our partners, that they can reach out and you can work directly with them to resolve these issues as soon as possible. So just trying to, again, tactical summary, the goal is for us to bring issues to the forefront. Right now, from a timing perspective, our scorecards current state run the middle of the following month. And so a lot of those issues can be outdated or simply just very old by the time you see them. By us pushing this up, both, and we'll get to this, the cadence will be pushed up to where you'll get the scorecard earlier, but also we want the data ingestion and the insights to be understood sooner as well, so that we can all take action on them and partner together to resolve issues within our mutual supply chain. We can go to the next slide. I apologize. I adjusted the graph, which moved that little red box over. So my apologies for that. But you can see on the left, to the right of the overall score, you'll see the how you compare section. And again, we explained that already, but these are the different tiers that we have based on the last 12 months of purchase dollars within our channel. Tier A is $100 million or more. Then we drop from 20 to 100 million, 5 to 20, 1 to 5, and our last tier, E, is less than $1 million. Just as a final, another aside, this is not a reference to your performance within our channel. We're not saying that this supplier on the left here gets a D for their performance. It is simply the tier that they are in based on their purchase dollars within our channel. We can go to the next slide. Scorecard communication. You can jump another one. We want to highlight really what you're going to be receiving and when. Our scorecard will go out monthly. Typically, like I just referenced, it is in the middle of the month. You get it about a week 10 days from now is when you would get the normal scorecard. We are moving that up a full week with intention of moving it up even further as time goes on. There are still some manual components of data ingestion and data intake that seem to draw the line in the sand that the earliest we could possibly send it is on the 4th or 5th of the month. But we want to review another day or so to make sure that everything is clean and to what we expect. And so I would anticipate between the 6th and 10th at the very latest, you would get your scorecard 1 week earlier than current state, and a commitment from me and from our team that we want to get that as early as possible sent to you. But we do need, for the expected delivery date plus 2 days, we do add a couple of days of buffer just to make sure we're getting in as much detail from a receipt standpoint. And then we need a couple of days to aggregate some of the EDI data. And so that's why we're in that 4 to 6 range as early as we could be, but we want to get it there every time. But the good news is you'll get data sooner and cleaner, and hopefully we can, again, improve that timeline. The scorecard will come from this GMB in the top left, our Med Supplier Performance GMB. You should already see the current scorecard coming from that GMB. That GMB is managed by my team, myself, and Rebecca Morey, who you'll hear from both of us probably along the way the next couple months. But we manage that GMB. That is what sends out all of our supplier reporting, whether it be the scorecard or our premium data services offering, which we'll talk about in a minute, or our supplier, any other supplier reporting that we do will come from that GMB. So that's one I would bookmark and make sure that you don't have that listed as spam on your side. That's an important one, and will be an important one go forward. Again, each scorecard email will look something like this. You'll have your compliance performance in the body of the email. You'll have your attachments, which will be the PDF, which will have the executive summary, the tactical summary, and the 2 definitions pages. And you'll have your backup detail, which is the raw data files of service level, lead time, and the 4 different EDI metrics. So you'll receive this every single time. If you have questions, we direct you to the GSM, which is in all caps at the bottom of the page. You'll see my name there. The typical email nomenclature is first name dot last name at cardinalhealth.com. If you are unfamiliar with your GSM, you can simply respond to the email, and Rebecca or I will respond and let you know who your GSM is or their email address. Or you can go to our GMB for the broader team, or broader national brand sourcing team. We try to limit the GMBs as much as possible. I think we're down to we'll get down to 2. But GMB-NB Med sourcing is our kind of our broader intake, just for our broader team that includes our Performance Plus organization, our KPI organization, and just our traditional GSM sourcing organization. But that's the tentative email, not tentative. That is the email along with who you should reach out to if you have questions or issues. Again, you can reach out to that GMB at the top left. You can respond directly to those emails and we can help route it. But your GSM is a great first stop for questions about this specific scorecard. And if you have questions about fees or performance, we can connect you with the EDI team, the appropriate EDI team, or the appropriate inventory team. Every supplier has a buyer within our organization, so we connect you with your inventory buyer who can help walk you through the service level piece. And then Rebecca and I, as the KPI supplier performance team, are intended to be supplier facing as well. We don't want to just generate these reports and push them out. We want to help partner with our suppliers as well to improve our mutual performance to our end customers. We can go to the next slide. And so we're making good time here. Apologize if I'm flying too fast, but the next steps here, you can go to the next slide. And then we have, again, as Chris mentioned, a small survey. We're really excited about what's coming up. And this ties to our hope for continuous improvement of this scorecard. This is not something that we're going to create and just leave for the next 6 months or a year. We want to continue adding to this scorecard. And so I want to hit on just a couple of these things that I think are really critical to performance and for us to consistently improve. The first is improving visibility. We know that we think that we can get trending weekly service level data to our supplier community. We need to understand what that looks like from a bandwidth to be able to send that out to potentially over 1,000 suppliers on a weekly basis. And so that has its own kind of set of issues to be able to execute upon that. But we want to be able to give weekly service level reporting so that basically after a month, it's not a surprise when you get your scorecard. You'll be able to see issues sooner, react to them, react for our end users that are undoubtedly asking questions if there are issues. But essentially, we think we can get from that monthly to a weekly. The scorecard would still be monthly, but have that weekly service level trending so that you can monitor your performance within our channel as often as possible. The next is new metrics. I mentioned the chargeback rejection rate, which again is the amount of discrepancies or issues within a reporting period. Because of the nature of chargebacks and the dispute windows that open and close at various times, that will probably be a metric that is updated at most quarterly, probably every 6 months, but something that we think is really important. Our chargebacks teams work together constantly, and it's something that we want to reflect how well it's going. Similarly, our teams work together in a great deal on PDM, which is our product data maintenance team, as well as our accounts payable team. Those groups work with you very, very often, and it can be constant even. And we want to have metrics in our scorecard that reflect a holistic relationship with Cardinal Health, not just service level and EDI, though those are extremely important. We want to be able to tie into PDM, AP, chargebacks, like we mentioned. We added ops to be able to do that, added our ease of business score that touches a few different teams. But we want to consistently add new metrics that reflect how well we're working together, and know that Cardinal is complicit in that as well. We're coming to the table knowing that some of the poor performance can actually be from us at times. And we want to work together to improve. The next is improving detail. And I already called out one area. I believe I failed to mention the tactical summary piece. The order statistics, that skinny little column on the executive summary, as well as our tactical summaries, we have the ability to swap things in and out if we find that they are more helpful or more advantageous for us to focus on. We can't do it individually by suppliers. That'd be one limitation. But if we find that there are specific statistics or views of our performance on the tactical summary that would be beneficial for us to focus on instead of something that we're looking at now, we would love to hear that feedback from you. And we would love to implement that if we believe that it will influence our supply chain at a broader level. So that's another ask for feedback. We want this to be a mutual project for us to improve our performance. This is not, we're pushing everything. We want there to be intake back to us so that we can improve our product that benefits you and benefits our customers. And lastly, I mentioned the automation piece on improving detail. That's something that we're excited to continue to add to. Solonis is a data mining tool that has a lot of potential inputs. We just need to find the best ones that fully communicate an ease of doing business score. And as we change those, we will communicate those back, obviously, to our supplier community. Obviously, I just hit on some of it. The feedback intake piece, we don't intend for this to be the only time we meet with our suppliers. We're not going to do this every 6 months and redo a training. We're happy to come join you if you need another training individually, but we want to send out surveys and have interviews along the next year or so to understand how it's going, what you would love to see changed. And just as a caveat, you don't need to wait for that to have your feedback sent to us. You can send it to the GMB that sends your scorecard. You can send it to your GSM. You can send it to me. I know I have a funny last name, but alex.shogoleff@cardinalhealth.com. You can email me anytime with any feedback. Would love to hear from you. And then lastly, for what's next, and this is long-term, is our Solonis access. We really love this Solonis tool. Long-term, it can actually be connected to directly by our supplier community. And so some of the improved visibility from the weekly standpoint can even go beyond that to where we think we could potentially have daily updates that are in there from a service level and EDI and other metrics performance that can be connected to. So you don't have to wait for us in any way. You can have direct access yourself to go right in and get an understanding of how you're performing, what you can change, what could be benefit or what could benefit our customers if you focus on. So we're really excited to get there. I think admittedly that might be a little bit longer term, longer ways off, but we would love to have a tool that is accessible by everyone. And obviously we would train and make sure folks feel comfortable, but that is something that we are also working to. Christian, we can go to the next slide. Wanted to mention this. Our team also, my team, Rebecca is our subject matter expert on medical distribution premium data services, which is a reporting offering of more granular data insights across our supply chain, and we give full visibility. Obviously, this does come with an investment from suppliers, but it lets you behind the curtain from a forecasting perspective, from an on-hand perspective, from a planned order perspective. We'll tell you what we anticipate ordering. Our feedback on the forecast accuracy perspective from one of our biggest suppliers has been very promising, above 80% as we look out 90 days. We're really proud of the offering that we have here, and that you can see on the right there that there's about 12 different reports bundled up into one that we're really excited to offer. And this is something that is going to be in the body of these scorecard emails, as well as the opportunity to get a feel for what this would look like to add this into your organization, to have these additional data insights beyond the scorecard that will help you plan appropriately, help you forecast appropriately for your supply chain and your business. If you have questions about that, again, you can ask the GSM team. You can ask the GMB here, has been managing a lot of this, the GMB-NB Med sourcing at cardinalhealth.com. You can send it to me or Chris. We would love to connect you. We'd love to give you a sample of what this would look like to let you digest how beneficial this could be to your organization. But it's something that we're really proud of, that we're consistently improving, consistently adding to, that we think that more than anything that we're offering right now, this can influence and improve your supply chain. So look for more on PDS, is what we call it, premium data services, something that we are hoping to partner with as many suppliers as we can on. That's it. I know we had this for a 90-minute training. Hopefully you can enjoy an extra 30 minutes back. Christian in a moment is going to add the survey as soon as the webinar ends. We would really, really value and appreciate your feedback if you wouldn't mind. It's just about 4 questions. 3 of them are just rating. Just hit a button 1 to 5. And then we do have 1 open text if you want to send us anything about your feelings about this webinar in and of itself, or the scorecard, or questions about PDS, anything that you want. We would love to hear from you. Again, we really, really appreciate and value the time to spend with you. If there are other members of your organization that weren't able to join, this is recording. We will be able to communicate this. Beyond that, we do have another training on the 16th, Tuesday the 16th at 2:30, same time. We'd love to see you then too. You're welcome to join both if you want to hear more from Chris and I. But again, thank you so much. We appreciate you. Thankful to have you, and we'll talk soon.